It's certainly very different from any emergency that I've responded to before. Straight off the plane, you're greeted immediately by a nurse in a mask with a bucket with a tap, having to wash your hands in chlorine. Many of the buildings that you have to go into around where our office is, you have your temperature checked before you go in. And then there's just the fact that it is always in the back of your mind. Ebola is always there, even when you're in low-risk areas. It is something you're always considering, washing your hands, being careful what you touch. Save the Children has been responding to this outbreak since the outbreak in Liberia was declared at the end of March. Our initial work, the first phase, was a lot of educating the public to try and get them doing things like washing their hands, like knowing what the symptoms of Ebola were in order to stop the spread. So we've done a lot of work on that already, which has reached a lot of people. We broadcast messages on 8 of the 15 counties in Liberia on the radio. We estimate we've reached about 260,000 people with that. What we're really hugely adding to our programs here is we're actually getting firmly into the health response side of things. So we built a treatment unit, an Ebola treatment unit in Bong, which I visited. It's now being run by an organisation called the International Medical Corps. They were extremely happy with the building we did on that treatment unit. They've said it's such a tricky thing to treat, with having to have areas where those who are infected go and those where doctors change. It has to be so precise, and they said that our building of that unit has allowed them to do their job very, very well. They have had patients come, receive treatment there, and able to leave having recovered from Ebola. We are building 10 community care centres. These will allow people from the local community in Monrovia to have somewhere they can go to be tested for Ebola. These community care centres are very much a Save the Children design. They're unlike anything that has been done in response to an Ebola outbreak before. The idea is that we will have a triage area, which is an area where people will be able to be vitally checked and tested for Ebola, and then it'll be split into 2 separate areas to stop cross-infection. So there'll be an area for people who test positive, and there'll be an area for care of people who did not test positive to Ebola. There are also other measures we're putting in place, which is designing these in a relatively open way so that people on the outside can see what's going on inside, and people don't think of it as quite so scary a place. Another thing we're putting in place for these 10 community care centres is we will have roving teams who can go and support with healthcare to each centre, as well as roving water, sanitation and hygiene teams who will help with making sure that they're being kept as clean as possible. They'll help with infection control. Do keep checking in for further updates on this as we continue to scale up our response.